We start now. So, my friends, I am here to talk to you about digital life with Ranges. The subject of this webinar is how to optimize your clinical routine on our day-by-day with digital dentistry. And talk all of us, how can we improve our clinic workflow and how can we share experience with one another and improve in every way possible and use as maximum the tools that the scanner that provides us to improve our work, our workflow in our clinic, and our capability of closing more estimated or budgets of patients, and how can we achieve that the patient explain to our patient better and they can understand better, and talk about a little bit of digital dentistry. My name is Dr. Garcia Palacios. I am from Latin America. I am a specialist in digital in implants. I also am a specialist in periodontic surgery. I'm a specialist in orthopedics and interceptive orthodontics. I am a CAD designer, and recently I'm a CAD consultant for the Ranges Group. I am the director and owner of 𝐖𝐞𝐤, private institute of dentistry, special dentistry. You can have the web link there. And I am the owner of 𝐖𝐞𝐤 Digital Lab, which is a digital lab for colleagues for design cases and help them to do a little bit more of digital dentistry. So let's talk about a little bit about digital dentistry. What is actually digital dentistry? That is the big question. Actually, digital dentistry is any technology that helps us to improve our workflow in dentistry. Anything that is computer-based, anything that replaces the older or mechanical way of doing stuff is digital dentistry. A scanner, it is digital dentistry, of course, but it's also digital dentistry, a portable X-ray, like the one that Ranges has. Digital dentistry, the sensor of X-rays that Ranges also has. Everything that helps us digitalize our workflow is digital dentistry. People think that because they don't have a scanner, they don't do digital dentistry. We are already doing digital dentistry when we have a portable X-ray, when we have a software on our clinic that helps us with the patients and the appointments and everything. So we are already doing digital dentistry without we knowing. And we should start by that. We should start by knowing that prior to us having scanners, oral scanners, we were already doing digital dentistry. So how does acquiring an oral scanner benefits us? Actually, it's a very simple question, but it looks difficult, but it's not. When we acquire oral scanner, that raises the level of differentiation in our clinic or dental office. We are different. We are more select. we create for the patient less discomfort. We cut our hours of office because the process takes less. We have greater precision and speed on our lab work because we don't have to explain to the lab everything that we have to do like on the old days, because we send the 3D model, and with the Regis oral scanner we can do it in color. So the dental technician doesn't have that problem anymore. So it creates a better way of communicating with our team of technicians. And on our patients, it's amazing how in our patients it absolutely changes the way that they see you when you scan their mouth, and you explain to them rotating their mouth on 3D on live, and you can tell them with precise detail absolutely everything that is going on in their mouth. And that creates another level of how the patient perceives your work, because he knows that you know what you're talking about, because you are taking the time to explain to the patient and show to the patient what's going on their mouth and how we can solve this problem and how we can diagnose the problems on our patients. Also, we always have the problem that is we want to share cases between colleagues, and always is a problem, and you have to send the pictures, and you have to send the x-rays, and you have to send everything. But nowadays, you just send a 3D file, and you send, if you want, also an x-rays or tomography or cone beam studies, and you don't have that problem anymore. So it shortens the distance, cuts the distance between colleagues and lab work in minutes. So we can share cases all over the world now, and we can discuss and we can debate and we can all grow together. So how do we part from this, which is a simple 3D, simple image of patients, of a tooth, sorry, to digital dentistry actually? How does an intraoral scanner works? So how does it actually work, the scanner? We must understand, my friends, that scanner is the equivalent of a Creighton mold. And our silicone, it's the light. So every time that we are scanning, we must understand that the tray to do the molds that we use, it's our device, but the light is actually the silicone. What takes the impression, what takes the image that creates the 3D model, it's our light, it's our silicone, it's our light. It's the light that emits the scanner. So we can transform this, we can transform this impression, this analogic impression of silicone into this. And that happens with all those images put together. so we can start forming image above image above image above image to create a mold, a mold of 3D that it looks like this. This is actually a mesh. This is how it actually works our scanner. It creates all the images that takes frame by frame, and he puts them together and creates a 3D model. And after that, nowadays we can, since this, we can do this. We can start giving it color, so we can tell the difference on our patients, and we can see better with our patient what's going on. There's actually 3 different types of files that our scanner provides us. The STL file, which is standard tessellation language, which is the most common file on digital dentistry that we can use. It has no color, but is the most common and most accepted one for the majority of the softwares that work with digital dentistry. For example, programs that they do aligners with, or programs that you have to import the STL file. The majority of them, or almost all of them, they use STL files for sure. Then we have the PLY, which is the PLY is a file that actually can store color. Personally, I love to work with PLY files because it allows me to save in color, and it transmits better the idea to our patients. And when we work on a software design or a CAD software to design a crown or design a gums correcting plastic surgery, we can choose, and it's better for us because we can see the difference and we can see the color, so it's easy for us. And then we have the OBJ file, which is the object file format, which is a heavier file that it's more heavy, but it's more accurate. Why? Because it has more points. It creates a mesh, but it's a little bit heavier, and not all of the softwares can use or have the option of using this kind of file. What is actually the elements that we have to consider when we are working with a scanner? First of all, it's a correct scanning technique. If we don't take a mold, analogic mold, a normal silicone mold, if we don't take a normal correct mold with, and we don't have the clinical expertise to know how and when to take a mold, it's the same with a scanner. The secret of scanning, it's that it should be dry, and it should be all the edges and all the edges of the preparation should be well marked. It should be dry and no blood. It's difficult sometimes, but it will be ideal with no blood, because our scanner, a difference with a silicone, our scanner takes the picture of the blood and makes the mistake that is part of the preparation. And sometimes when we scan, we don't have we see a little bit drops our blood, or we can see that it wasn't accurate, is because the scanner takes a picture. Remember that the mold doesn't care, the silicone doesn't care, and when you mold, it's gonna pull the blood out, but it's not gonna be as accurate or fast. So the only thing that we have to consider is that remember always that we need to make sure that our preparation is very dry and of preference without blood on the part that we want to scan. Always complete the information that we need on the software that appears on us, on the software that we have to complete, because remember, the moment that we feed the most amount of information to our software, the scanner is going to know where to scan. If we don't mark what is the scanner job to do, if we don't mark the tooth that we want to do a crown, or we want to do a veneer or an inlay, and the tooth that they are adjacent, remember that the most information that we provide to our scanner, the better job our scanner is going to do. Because he knows where to scan if we tell them what is the tooth that we want to work with. So the amount of information that he needs is going to be better if we provide the proper information that the software requires. Also, when we work with digital dentistry, we must be certain that the lab technicians that we work with also understand the digital dentistry world. It doesn't have sense if we do digital dentistry, we have the scanner, we scan our patients, we send the file, and they don't work with digital dentistry. They don't know how to design a crown, and they have to, again, they have to send it to someone else to do it. Or they ask you if you can 3D print your crown, or you can 3D print your model to send to the crown, to the lab work to do a crown. It doesn't have sense. So remember that our lab technician has to be our friend, and he has to be on the same philosophy that us, because we need to work with people that want to get at the top of dentistry and provide a better service to our patients. So always make sure that the people that work with us when we are doing digital dentistry must understand that they have to understand and work with the same kind of technology. A little tip also, when we are doing digital dentistry, it's always better that the preparations that we are doing for veneers, for crowns, for onlays, always make them a little bit more marked, a little bit more, the shoulders have to be more defined and have to be well marked. This is something that I always say to everyone that I give lecture to, because it's better for this CAD designer, for the software and the CAD designer, to see very well define the shoulder of the preparation. It doesn't matter if it is a veneer or a crown or an onlay. And always know the depth, knowing depth, all the tools that our scanner provides us. We have to know our scanner. We have to know what he can do for us, so we can squeeze the 100% of all the tools that our scanner has for us, so we can seize that and we can use it in our dental office to explain to the patients, or create a health report, or do aligners or implant cases or restoration cases. So we bought a scanner, oral scanner, and the question is actually, and now what is next? How do I implement in the day-by-day practice of the clinic? What can I do with my scanner, and how my scanner helps me to improve my workflow? These are actually very valid questions. Let me know if I'm going too fast, or we can stop. We are going to stop for questions also, so we can discuss and debate all together. So is everyone okay? Is anyone has any questions that we can ask or we can debate together? Please, I'm here. Hello, doctor. Good days. Thank you for your presentation. Tell me about the real color. Yes, we can store our file when we export, and when we export our file, when we're going to send it, we can choose what type of file we can use to export our case. And when we export our case in a PLY format or a OBJ format, the file actually contains the color of the mouth. So it's better for communicating and for designing with our patients. I don't know if I answered that questions with that. Okay, let's continue. How about that? Any questions? We don't need to, Elnur, we don't need to calibrate our scanner. This scanner, the option that has is that it actually auto calibrates itself, so it doesn't need calibration. The scanner doesn't take the actual color of the tooth, but takes color of the mold. It's always takes color of the 3D file, which is better for determining the margins and determining the color of our tooth. But it's very difficult for the lab to understand that. So we always must, when we are feeding the software to start scanning, the actual software asks us of the color of the tooth. Because remember that we need to scan, if we scan on a dry area, the color is not going to be equal to the normal color of the patient. A dry tooth has not the exact same color of a tooth of our teeth when they are wet. So we always must take color first. So the job and the color that we decide is going to be better for determining the exact color that we are going to send to the lab work. Yes, actually, the role that has on surgical templates, it's actually quite important. Me as a surgeon, it's very important for me to use just a moment, please. So when we are creating a surgical guide, we must have a proper scanner that creates a perfect mold, because the surgical guide is gonna be mounted on that mount. So our scanner has to be accurate. I actually use quite very much my scanner for creating molds and unite them with the cone beam studies to create surgical guides. So with our tomograph studies, we can create a proper guide for doing surgical purposes. It's actually quite important. If we know that digital dentistry is gonna on a surgical specialty is gonna provide us with guided surgery, along with X-ray proper studies, and I think it's called MRI, and scanning. That is actually the future of digital surgery. Actually, implant surgery is gonna evolve in guided surgery. That is something that is gonna happen. Implants are gonna evolve in guided surgery. Why? Because we are searching for more and easier ways for our patients. And so if we can do surgery with a template, with a surgical guide that provides us with the more accurate way of placing an implant without doing a huge opening on our patient's mouth, and do it as little and atraumatic as possible, it's something that is going to evolve on that. So guided surgery is going to be a huge part of the implant specialty in very short time. It's already doing it, it's already happening, but it's going to be, I think it's going to be the way in which digital dentistry and digital surgery is going to evolve. Please tell me about the scanner temperature when I have to that stand by. Yes, actually, yes. The point of our scanner heats up, and so it doesn't. We have to wait a little bit when to cool down, and there's actually a sign that tells us when the tip of our scanner is working for a long period. So, and that creates heat, and the heat must be dissipated. That light that emits creates heat. So our scanner must, when it reaches certain temperature, creates a temperature for a scanner that doesn't work properly. So when it's starting to get a little bit hot, the tip of the scanner, the software already asks us about with a sign that says the tip of the scanner is heating up. Please wait a couple of minutes. And that is just to prevent the overheating of the tip of the scanner. But when that happens, it's actually because we must be taking so long. We are taking too much time on scanning our patient's mouth, because the ability that the scanner has to scan the mouth of our patient as fast as this scanner can do gives us so much time to scan a full mouth without the tip of the scanner heating up. So we have to, on that case, we have to review our scanning technique, improve it a little better, and I'm pretty sure that you're not going to have that problem. And talk about the BiScan on the full arc cases. Yes, actually, the scanner on the full arc cases, there's a way that we can do this with doing a scanning for all-in-4 and cases like implants. When you have full arc superior and inferior cases, that there is a way of we can scan actually, but we are gonna get to that on a little bit ahead on the case on the presentation. We're gonna debate about that a little bit more. So let's continue a little bit. So let's talk a little bit about the Rangers software tools and the new updates that we have, okay? With this new update that we have. First of all, the new update of our software, of our Rangers software, gives us a control panel that gives us a review on our use of our scanner. So that actually is very, very good, because if we want to know how can we improve our cases, if we want to know how can we improve our workflow in the clinic, we already have how many cases of restorations we did, how many cases of orthodontics we did, how many cases of implants we did, how many cases of informs we did. So we have the time, we have how many did we share to the cloud, we have all the statistics that we need to know how much we are using our scanner. So that is a very important tool for understanding if we are taking advantage of our scanner in their full potential. So then we have our menu that gives us the different kinds of all the patients that we have and all the cases that are completed, not completed, and our favorite cases. So we're going to take a case and we're going to use it. For example, let's say we are going to use a restoration type. We choose, and we have this. We should choose the tooth, the doctor that is responsible, the technician, and all the what we need to do for our data for our patient. We use a crown, or we can choose a zirconium multi-layer. We have a disilicate crown, provisional crown, veneers, a bunch of onlays, and normal tooths, absent tooths, and antagonist. Then we choose the material, and then we choose the color of the tooth that we want to do. That is what I'm saying. That was what I'm saying, that if we are going to take the color of our tooth, remember, we need to take the color of our tooth wet, humid. Why? Because that is actually is more reliable to take the color of our tooth or the adjacent tooths of our the tooth that we want to restore, because it's different when we do a tooth wet than we do a tooth dry. Our scanner works better if it is dry, even though the scanner has an amazing tool that is called, that we're going to see a little bit more ahead, the AI tool that helps us a lot with saliva, with our soft tissue. It's very, very good. But for prosthetic reasons, remember always that we should take the color first prior to scanning, always. Then we have if we are going to do a implant or screw retain or a substructure of that implant. So then we have this, that is everything that we always know, that is all of us know this, which is we have our scanning screen, and we always start for the upper, or we can choose that. We can start for the upper or the lower region without any problem. And then this is our whole of, we can choose the real color. This is the AI function that I told them, the block the angle of it. And the amazing feature is we can scan metal. Scanning metal or a shiny, anything that is quite shiny on our mouth, like for example, brackets with with people that have orthodontic treatments, and we want to do a crown on a person that has orthodontic treatments and has metal brackets, it creates a problem for a normal scanner. So this option that has for metal scanning and the AI and the real color are actually quite good. Then we have our normal tools, which is we have an eraser, we have a scissor to cut our models, to cut them and make them as better as we can, so it doesn't take much space as we need. Then we can eliminate, we can take pictures, we can actually we can do a lot of stuff with these tools that we have on our disposition. Then finish the processing of our scanner of the images and creates the model. We can choose how to export that kind of file. So this scanner is actually, this is now it's already being updated, and now we can work with even more softwares now. But the normal ones are Exocad, Preshape, Blue Sky, and all the others. And we can also export to a RZIP to make sure that we can export on the type of file that they choose to be. And that is actually quite good. We can be able to choose the file that we're going to export our case. PLY, SPL, OBG, 2 of them, 3 of them. We can export in all 3 types of files if we want, because this software and this option gives us that option, the software. So let's continue a little bit with the questions that we have on our scanner and our software. Do we have any questions? Let me know. Okay. There is a new integration with a 3D printing brand. Yes, actually, doesn't matter what type of 3D printing brand there is. When you export the software, and actually our software also has the option of creating already a model base that gives us the way that we can export to any 3D printing brand. But yes, there is actually 𝐖𝐞𝐛𝐢𝐧𝐚𝐫 is new. It's available in the new version that is actually correct, and the integration with the clear aligners is also correct. Is coming. Yes. How can I comfortably scan in a toothless mouth? Okay. Actually, I have a lot of cases that I have scanned with toothless mouth without any questions. I have done proper full prosthetic, full dentures with our scanner, with our normal scanner. Our scanner is actually quite intelligent. Is quite noble on that matter, because it can give us the way that we can scan our mouth properly. Also, it's my recommendation to turn off the AI, because our AI gives us the differentiation of not scanning soft tissue. So if you are going to scan a toothless patient, remember to turn off the AI. It's going to be better to scan the mouth of the patient. How is your experience with all-on-4 or all-on-6 implants? Actually, yes, it is. I have successful cases to design when we are going to do guided surgery. If we are going to do guided surgery, what we need is a scan of we need a tomograph of the patient's mouth and the patient's prosthetic. After that, actually, when we finish scanning, when we finish the surgery, I have scanned patients after all in 4 surgeries and after or all in 6 surgeries with our implants and restore like a normal restoration. There's a problem with the biting, and we have to determine the biting. The biting has to be determined in certain way to make sure that our biting is registered prior to the scanning or the surgery to keep the biting registered. If not, we're not going to have the vertical dimension of it. To scan for mouth guard, how the customer can take occlusal registration. Okay, so when we are going to scan our mouth, we are going to scan normally our mouth, and actually for a mouth guard, the recommendable is to lift about 6 millimeters. Actually, either we can do that with the difference of type of occlusions that this software gives us, but that is actually done in another software to determine and position the proper the position and do on a digital articulator on a designer software. Actually, I do that, but I use another software to mount our 3D models provided by our software or by our oral scanner, and I mount them on a digital articulator on another design software where I can create the mouth guard and determine the height that we want. You're telling me that you want to keep the bite open and register the bite open? Actually, there's 2 ways of doing that. That's what I'm telling you. The proper way is to doing that on a design software, and you can lift on when you mount on our digital articulator. There's an option when you mount it on an extracut articulator, you can lift up the amount of millimeters of the bite that you want. So you can create the proper ways and the proper height that you want to do that to create the mouth guard. The other way is, if you're going to do it analogically, is to do a bite registry, 2 bite registries on the height that you want. So you're gonna do 2 little mouth registration. For example, C-Lab or another silicone occlusion registration product, and you're gonna make them bite. And then when you are going to register one, you scan the other side, and then you remove and you put the other one, and you scan the other side. So you are going to get that height and that space to design the device that you're telling me. But the ideal will be to mount it on a digital articulator to make sure that you can create the proper movements that the mouth needs and our teeth needs. So the protrusion, the retrusion, and the lateral, that is actually done on a digital articulator that actually recreates all those, and even you can create the mouth guard, the night guard. Well, if you're doing like I told you, if you want to do it the analogical way, you can just take two different pieces of silicone, do the biting registration, and then just take one and do the other, and alternate, and you're gonna have no problem. So let's continue a little bit with our presentation. So let's talk about our new introduction to this software that now it's already has evolved, because thank God to our Ranges friends that they are constantly evolving, and they are listening to all the customers, and they're improving along the customers. Tell them, I think that this we can improve or not. And I have already seen that in person as a client. I have seen that they have listened to me, and that is actually, it feels very, very good when a customer is listened, and they take in notice and they take in account what's going on and how you have a problem, and they are actually very, very good and very, very very human group of people that work with that I have chatted with on Ranges team, that they help us to solve our problems. And me, when I was a client of Ranges, I have so many questions, and I always had the opportunity of having an answer and talk with another person that helps me in some kind of level during my forming in digital dentistry and using the Ranges scanner. So let's talk about the functions that we have. So this is one of our functions that we can block the view that we are to scan. So if we don't want to move our mold, our scan, we know that we can do this. So it's better for us to not rescanning. Then we have our HD. We have a high definition camera for explaining, and also to document us when we are going to explain to our patient what's going on. Then we have also we have different types of biting that we can use on this option. Is very, very important when we finish a scanning process to prove and check that the biting that we scan is the biting of the patient. Because sometimes the patient, while we are turning the other way to do the other side of the bite, it changes the bite. So it confuses the scanner, and we don't have a proper bite. So that is actually, remember always to check that after we did the biting, check if the biting is correct on our patient. Check, compare with the one that we have on the screen, and compare with the one that we have on the mouth. And the good part is that in this scanner, this has an inclusion check option that can give you an auto bite, so it can close or it can open the bite depending on what the software needs, the things that it must bite, and it has an optimized bite. So we have also a different types of biting if we are not comfortable with the biting of the patient. Then we have this option, which is a very good option, which is to scanning the metal, as I was saying. Is a very, very good option, because there's so many times in our clinical life that a implant comes to our office, that an implant it's not very well positioned, and the direction of the implant is not the one that we there's not a way to solve it if we don't do a substructure, a metal substructure or an angulated pin. So we can install that first, and we can do it on metal or zirconia to change the angulation of the channel of the screw, and we can do it that way. And now we can design the substructure of the implant to align it with so the exit of the screw is actually on the path that we want. And usually that is done by custom abutments, and that is done by we can do that on metal or zirconia. And when we're doing on metal, sometimes it's difficult because it takes a little bit to scanning that process, or a substructure, or or just a single crown. And sometimes it's hard. And the option of scanning the metal, or scanning the metal of a case of a patient that has brackets, that has orthodontics retainers, or some metal in his mouth, is actually very difficult to scan. But with this option, actually makes it very, very easy. You can see the level of the level that we have here is actually very, very good. It's very accurate. So this helps us a lot at the time that we want to do a single crown over a metal restoration, or metal pin, or metal abutment. We're gonna now is the health report mode. The health report mode is actually a very, very good option for us to use when we are doing a first consultation. So how much different is going to be our office when you take the time to scan our patient, do a health report on the patient. It actually takes pictures of what's going on, so the patient knows exactly what has and what we can do, and we can explain to the patient in detail what's going on and how we can solve that problem. So, and if we do an estimated, a budget estimated on that kind of patient, that he knew that we took our time to do a health report, to do a pictures, to explain to the patient in full detail, sharing our screen, our software with a screen of our TV on our office, or a TV or our monitor that we have, it's going to be so much different in the way that the patient perceives us as professionals, and how serious we are. And he is probably going to do the things that we recommend them to do, because they can see for themselves what the problem is. So it's so much different when the patient understands what's going on his mouth. So it's so different for them, and so different for us, because they're more willing to do the treatment because they can see for themselves. And even the application that our health report has, which is even takes us and diagnose, it has gum recession problem, cavities, buildups, tartar, call it whatever. But it's so amazing that technology can do calculus determination, can do cavities, can do gum recession problem, gum receiving problems, and that it surprises to the patient. Even though we have to guide our comments and guide what is going on that function, but it's so very much different for our patient, and they're more willing to do the treatment that we recommend when we have that option that we can give to them, and they see the first consultation so much in such a different way, and that helps us improve our income on our offices and our workflow day by day, because with a proper explanation, with a proper estimated, there's gonna be improvement our income in the day by day. We can always add a base to our model. That was where we're saying that this is a model generator function that we can do that. So, and we can align that to the proper aligning. So that is actually a very, very good option. I like that a lot. We can do also a undercut of the height. Like I tell, the whole report issue is actually it has been amazing for me, because I've seen the difference on the patients. I've seen what we can do, and if we use well, it can be a very, very helping tool, a very, very good ally in our first consultation appointments. And like I said, this software now gives us the option of sharing cases all over the world, fast and easier for all of us. And let's talk about a little bit about the implants that we were saying.
El nuevo software añade la función de...
So after we created a mold for our upper or lower arc, and then the software actually, when we're going to scan the scan bodies, it duplicates the arc in question. So what we do is, what we do is we erase the part of the scan body that it's needed, and then we rescan to make sure that is and recognizes the scan body. We can either import our scan body from our library or library that we have created, or we can import it from the manufacturer of the implants that we work with. So there's both ways, and it actually makes it faster to register and match the implant scan bodies on our mouth. So because when we already select the type of implant that we're going to work with, it's faster for us and it's faster for the patient and less comfort for the patient. In my experience, this process is very, very fast, even more when you already have the library scan that is actually and this is how we fabricate our library, so we can register a scan body of the implant that we work with. So we already have it on display, and we can choose the implant quickly, and so the scan is faster. Actually, yes, it's a very nice function. It really, really helps because it makes easier to register cases on matching the implant scan bodies. It makes it easier and faster. When do I use most this kind of, and basically I use it every single day that I'm going to do an implant case, scan an implant case. But when I'm doing surgery, when I'm doing a bi-registry, when I'm doing for example, a all-in-4 surgery, I already placed my implants. I already placed my pillars. I scanned everything. Remember, doing a traumatic surgery or guided surgery where the tissue is not very, very harmed. Either way, with a normal surgery, with a proper scanning technique, you can do this. I already installed my pillars in all-in-4 cases. Then I proceed to scanning like a normal case. And sometimes because of the blood or the saliva or everything, it's difficult to scan my mouth. But with my scan bodies, if I already put the library on, it helps me a lot because it's faster. So I don't need to scan everything, because as soon as it just gets a little bit of the scan body, it already matches and it helps to be faster. So what happens when we are going to do a full arc case? So now we have an option inside this scan, in this configuration of the scanner, which is we can, at the moment that we are going to delete everything on delete the space of where we are gonna do our scan bodies scan, we can choose to delete absolutely everything except one part of the soft tissue, so you can rescan and then you can get a matching function. Then you can transport that to a CAD software, and then you can do a clinical case of all-in-4 without any normal questions. The idea will be to have a additional mesh to already register the binding that we wanted to achieve. So there's two options, and I'm confident, and I'm sure that Ranges is already evolving and already thinking about this matter. So I'm very confident that we are going to see a result very, very fast, and then a very more personalized option for implants and full arch cases and full oral rehabilitation cases. That is going to give us the next step on this software and then on this oral and this scanner. Because like I said, everything that I have contributed to or I asked to the Ranches family, they have respond fast, quickly, and they have improved the scanner and the software every single time. The fastest company that I've ever worked with, and it's it feels very good to know that everything that I said to them as a client, I can see it now on this for this software, these updates of softwares that I can use. I use in my everyday. So let's talk about some clinical cases that I've done with our software. This is a clinical case of a patient that I choose this case because it has absolutely everything. This is a patient of mine that had a implant and all veneers and one crown. I scanned the patient and I created a file on a PLY file and did already the copy. I did a mock-up. I did a wax up of how will be the design of what I wanted to change on our patients. Then we created a model, we 3D print that, and we put it on the mouth, and we see where it was the problem. And like I said, I took the color, when we are gonna scan, remember to take the color humid, not dry. The patient had a very dark tone of teeth. And this is an option that we did. We removed the veneers that he had. We removed the crown that he had and removed the crown over the implant. This is a normal way that on the middle image, that is a normal way that we're doing the scan. That is the scan that we always do, the normal way with a silicone, with an open tray mold. And on our right, on our last image, we can see the scan body that helps us to digitalize this case. We can see the images and how we are doing this and how we digitalize this case. And then we can 3D print that, and you can see what is the difference in digital dentistry. Because our scan didn't have a bad day, didn't have a bad night. Our scanner works exactly the same every single time. There's no human error. And in dentistry, the best way of doing dentistry is to reduce to the minimum as possible the possibility of errors during the manufacturing of the process of fabrication of an element or a crown, veneer, or whatever. So when we use an oral scanner or we do digital dentistry, our scanner didn't have a bad night. Our scanner didn't went out drinking. Our scanner didn't have is not hurried. The scanner works every single time the exact same way. So and takes the pictures and creates a 3D model the exact same way every single time. So there's the probability of having a bad scanning is less with digital dentistry than having a bad mold with analogic dentistry. So we can see the difference between a digital normal digital model and a normal model. Who hasn't here had this problem, the bubble problem? Who hasn't here had the problem that when you pour the cast, the most important place that we need it to be accurate has a bubble? Who hasn't had that problem? Who hasn't had that problem? Then when we did a restoration and we were preparing the restoration had to be a little bit more profound, and we had to rescan, or we had to call the patient up, make him come again, and do a further preparation and redo the preparation. When we have this, when we have our scan, when we have our scanner, we can do a preparation, check the binding, and if it needs a little bit more, or it's too thick, or it needs a little bit more, we just erase, and then we just rescan again, and that's it. Less time for us, less time for the patient, less inconvenience for all of us. So after I did the scanning and the preparation, I created the base of a crown for doing the exact same thickness and the exact same shape of preparations, even to match with the implant. So the implant to match all the other preparations. So I know that we're going to have a better solution. And then we finish it up on the software design. And this is the final case. So we have a veneer, we have an implant case, a crown over an implant, we have a veneer again, and then we have a crown again. This is a difficult case because it has all the options, and it has the fact that the patient just wanted those 4 teeth treated. He didn't want veneers, he didn't want all the other options. This is another clinical case. This is a patient of mine that he was not comfortable with the gap between his teeth. He had aligners 2 times done, and he didn't use the proper retainer, and it opened back again. Then he chewed chip and broke the edges of the teeth, so he wasn't happy with his smile. We can see the spaces between his teeth. We can see the spaces that he wanted to close. We did a preparation in this patient. We did veneers. We did a full set of veneers from premolar to premolar in this case, and we did 9 elements. We did the preparation on the patient. This is how he looked. This was our preparation. And this is our final resort of our patient. We did a gap closing veneers. These are monolithic veneers with a very, very subtle anatomy and texture, and we did a little bit of makeup on every single teeth. So when he smiled, we can see we could see the difference. The patient was very, very happy with the result, and we were very, very happy with the result in closing the gaps and distributing the lengths and the gaps. So make sure that it was still aesthetic resolution of the case. So if there's any questions, please be my guest. We're going to continue to debate and all learn together. Do we have any questions? Somebody can want to ask something? No. Any questions that we have? Anything that was left unsaid? Thank you, Rita. Thank you so much. We are always happy to help, and it's very important to listen to different points of view all over the world, so we can share experiences and share with all of them. Still, because digital dentistry is still up today a very small group of colleagues in the world that we do digital dentistry. So it's very important if we can all collaborate and share cases and share experiences and see how we can do this and the other and talk a little bit more. And if you guys have any questions whatsoever, you can, this is my Instagram page. You can guys search for me on Instagram and we can continue talking there if you guys have any questions, or I can show them any tips and tricks, or we can debate and we can share tips and tricks also on cases and types of design. Or I have cases for example, how to do mouth guards on the 𝐸𝐸𝐶𝐻. There's videos of me doing 𝐸𝐸𝐶𝐻 mouth guards and designing and mounting on digital articulators on 𝐸𝐸𝐶𝐻. So if that can help you, Richard, that would be awesome. You can take a look on that. It's going to help you a lot. Dr. Mohammed, thank you so much. Dr. Mohammed, I would like to thank you, Dr. Mohammed, because he has been very, very, very determined to me to doing this presentation, and he was so delighted, and I am so thankful to all the Ranges team and him to make sure that the presentation and share the knowledge that all of us have in different matters and different approaches, so we can continue evolving all of us together. Thank you so much, Richard. Thank you, Alnur. Thank you so much. So this is my Instagram page. Like I said, you guys can search for me there. You can send me any questions. You can send me any doubts, and we can debate together. So thank you very much, guys.